Thompson. I'm Cancer Prevention Programs Manager at Nevada Cancer Coalition. May is Skin Cancer Awareness and Prevention Month, and today we are here talking with Dr. Irene Mannering. Dr. Mannering is a board-certified dermatologist who practices at Skin Cancer and Dermatology Institute in Sparks and at SCDI offices all across Northern Nevada. Thank you so much for being here with us today, Dr. Mannering.
Thank you. Thank you for the opportunity. I look forward to talking with you.
Thank you. We're going to talk about all things skin cancer. So if you would start off, please just tell us what causes skin cancer and what is skin cancer?
Yeah, so the most common cause of skin cancer is UV radiation, which comes from sunlight, but not everybody gets skin cancer who's exposed to sunlight. So certain things about an individual may predispose them to skin cancer more than another, and that might be family history or fair skin, light eyes. The increased number of moles a person has increases their risk for certain types of skin cancers. Other things too that might not be so much family history, but someone who maybe has chronic immunosuppression, meaning that their immune system is weaker, possibly from being on medications, or they have a type of cancer that does that. Certain things like tanning use and tanning booth use and history of burning, blistering sunburns put you at higher risk as well. But the most common skin cancers that we have, the most common one is called a basal cell carcinoma. This is a very slow growing skin cancer that's usually locally aggressive, meaning that it doesn't typically spread to other parts of the body, but just kind of festers in that one area. And then the second most common skin cancer out there is called squamous cell carcinoma. And this one is a little faster growing and can be aggressive. And then the other one we all hear about too is called melanoma. And melanoma can be very aggressive, and you want to catch that early. So some things to look for with skin cancer, or do you have skin cancer, or how do I tell if I have skin cancer? And you want to look for something that's changing. It's not itself, or it suddenly appeared and it's growing and it's not healing, or it looks a lot different than everything else on your skin. And it's been like that for more than a few weeks straight, not just something that popped up one day and then kind of disappeared. But if it keeps lingering or goes away and comes back, that might be a sign that you may have a skin cancer.
So are you telling us that we need to not be out in the sun?
No, that's definitely not what I'm saying, but I would like you to be careful when you're out in the sun. So when you go outside, we have a beautiful environment here with lots of activities for everyone to do, from young to old, with hiking and swimming at the lake and skiing. And you can still do all those activities. You just need to be safe about it. So you want to protect your skin. You want to, if you're going hiking, you want to wear a hat, a broad-brimmed hat, sunglasses. People can get skin cancer on their eyelids and in their eyes. And so you want to make sure you wear things like that. You want to reapply sunscreen every couple hours. And when picking a sunscreen, you want to pick something that is broad spectrum and has at least an SPF of 30 SPF. Here in Northern Nevada, we live in a high altitude, so our sun is very strong. So you need to, do these measures if you're going to go out in the peak hours of the day. And protective clothing as well, like long sleeves without overheating. But no, you should not hide from the sun.
Well, that's
in a
good,
sense, like avoid going outside.
Right. Well, that's good to hear, because we love where we live and we want to be able to be out and enjoy it. But as you say, do so safely and practice wearing sunscreen, using clothing, hats, sunglasses, all those things that help protect our skin.
Yes.
Well, you mentioned basal cell carcinoma and squamous cell carcinoma as the two very common types. How are those types of skin cancers treated?
Okay, well, it kind of depends on the individual and what the molecular kind of histological appearance is after you do a biopsy. That can kind of dictate how you do it. But let's say it's a very superficial skin cancer, whether it's squamous cell or basal cell, you may do sometimes there's actually topical medications that can be used. But most of the time you have to cut them out. And depending on the location where the skin cancer is, there are certain types of procedures that are done. Something called Mohs surgery is a tissue sparing type of treatment that's done in areas where there's not a lot of tissue, like your face or your ears, your nose, your lips. But most of the time it's a surgical treatment, but there are some medical treatments available as well.
So do people need to be concerned if they hear that they've gotten one of those kinds of skin cancer, and how common is it?
So, yes, you should be concerned in the sense that you have a skin cancer. It shouldn't just stay there forever, because it just can fester, like a basal cell can fester and get larger and larger. And in those very large cases, you can get cases where they spread to other parts of the body. And the same thing with squamous cell, if you let that stay on your body long enough, it could spread. And so you should be concerned in the sense that you need to do something for it and not just let it sit there. But most of the time, they're pretty well-behaved cancers in the sense that you cut them out and they're removed, and they have very high cure rates after that. So yes and no is the answer there.
So if you're someone who has one of those types of cancers, a basal cell or a squamous cell carcinoma, and it's removed, it's excised, is it likely that that kind of cancer will come back again somewhere else on your body?
Yeah, so skin cancer, it can come back in the same location. Sometimes the skin cancer is more aggressive and, it's deeper. It can reoccur in the same location. Or if it were to be more aggressive, it could get into the bloodstream and spread to another part of the body. But a thing with skin cancer is if you've had a basal cell or a squamous cell diagnosis, or even melanoma, once you're diagnosed with skin cancer, you are at increased risk for subsequent lesions, not necessarily the same one, but you may get another one, because skin cancer appears because you've had intense sun exposure in your life or other risk factors. And so that's not just to that little spot on your skin, it's all your sun exposed areas that you've had. So I guess you can, yes, it can spread, but you could also get a new one somewhere else. And once you've had one, you are at higher risk for developing another one. And so, for example, about 40 to 50% of patients who've had a basal cell will develop another one within 5 years of that initial basal cell.
So it sounds like it's important to check your skin regularly.
Yes.
What do you recommend people do about that?
So someone who's never had a history of skin cancer, minimal sun exposure and not a lot of moles, they probably could get by every few years doing a skin check, but they may not be going into the doctor's office for an actual skin check, but they should be checking their skin on their own at home. And it's easy to do that now because we have iPhones and iPads. We can take pictures of lesions and monitor them ourselves at home. So I often tell people, if there's something concerning you, take a picture of it, then take the picture again, the same distance, same lighting 1 month later, and try to see if it's changing. But people who've had skin cancer, they may need to be seen annually, or every 6 months or every 3 months, just to kind of depending on their situation and their risk factors.
Right. So at what age do these more common types of skin cancer start to show up, as a general rule, especially for someone, as you describe, who is fair, who's had a lot of sun exposure, who may have a lot of moles or freckles? When should you really start paying very close attention?
Well, so skin cancers like the non-melanoma skin cancers, which are the basal cell and squamous cell carcinoma, historically, they probably would appear more in the latter half of the year, like 50 and up, or in latter half of life. But we are seeing skin cancer appearing in younger individuals in their 30s and 40s, even, and rarely in their 20s. And it really just kind of depends on the family history and their prior sun exposure in their early life, because most people actually surprisingly will get their most sun exposure before the age of 18. So depending on where you lived and your lifestyle, you may have gotten an incredible amount of sun exposure through sunburns as a child. And so you may present with your skin cancer a little earlier. And those are usually like basal cells. And then squamous cells will be more of a cumulative sun exposure. So those tend to happen later. And so I would say majority of my patients are probably in their 50s, 60s, 70s that really start getting basal cells and squamous cells.
So those who are 50 and up certainly need to be checking very, very carefully. But for all the parents out there, it sounds
Yeah.
like it's really important that they teach their children and help their children practice sun safety habits.
Yes, and especially in our climates with the high altitude here in Las Vegas and Nevada, we have a lot of sun, and so it's important to establish these behaviors early in life and with sun protection in children, because it will really impact how their skin is when they're older.
Do you have any tips for how to get a squirmy toddler to want to allow you to put their sunscreen on without them throwing a fit?
That's tough. That is very tough. Maybe in batches, do the face, let them protest, and then move on to another body part. Another thing is they won't let you put sunscreen on protective clothing. If it's not, the temperatures aren't too hot, will help, like hats and long sleeves, just to kind of try to keep the skin covered. But that is definitely a challenge I have even with my own children, and they're not toddlers. So
Yes, I remember that well too.
yes.
So, if you are someone who's had a skin cancer, but is there anything beyond practicing those sun safety habits that you've described that will be important to do to try to prevent a recurrence? Is there?
Yeah, so it's someone who's had a skin cancer should visit a dermatologist and get an annual skin check, or maybe every 6 months, depending on how aggressive their skin cancer was. But they should also be doing monthly skin checks on their own at their home, looking at their skin lesions, and if they can't see things on their back, or ask a family member or friend to take a look at the skin, and if there's any questions. Either if you can't get into the dermatologist right away, at least start with your primary care physician. And the same thing for children. I mean, parents should be aware of new moles developing on children. It's rare to have skin cancer as a child, but it's possible. And children are going to have moles as well. It's just they don't typically have skin cancer, but it's important for the pediatricians and the parents to, start examining the skin as well in young children. And if there's any questions, they can always refer to a dermatologist.
So it's important, it sounds like, that you be asking your primary care physician, your child's pediatrician, to do that skin check for you if that's not something that is initiated on their own.
Yeah, if there are concerning lesions. I mean, some children don't really have many moles, so it may just be 1 or 2 moles. But in someone who has a lot of moles, if the primary care doctor doesn't feel comfortable, they should be referred to a dermatologist. But the primary care is a good start to take a peek at the skin.
Great. I've read that a healthy diet plays a role in helping protect one's skin from skin cancers. Can you speak to the role of diet and in terms of skin health?
Yeah, so I mean, there's kind of mixed data on whether or not diet does play a direct impact. There is some conflicting also information possibly pointing to smoking as a cause or a risk factor for skin cancer. But there are certain foods that are possibly thought to be protective for skin cancer. And there's a chemical in grapes. So grapes have a component that possibly could keep you free of non-melanoma skin cancers. Other things, obesity and poor health, the kind of general health of the person may not be well, and the same for the skin. But the main thing is, you want to live a healthy life in all components, because the skin is a large organ, just like the other organs in the body, and it can definitely be impacted by diet. Just exactly what correlation is still under review.
Thank you so very much for talking with us. Is there anything I haven't touched on that we should?
I just, want to emphasize that people need to be aware of their skin and pay attention to the skin lesions that they have, and keep an eye on things that if they are changing or itching or bleeding or hurting or not healing, and it's been more than a few weeks of that, don't ignore it, get it checked out. And if you don't have access to a dermatologist, primary care, pediatricians is a good start, and then it can go from there. And your phone can also offer a great tool to help you track your skin skin concerns because it takes photos and it documents the date and the location, and you can compare side to side photos. So we have a lot more tools to use at home now too, to try to keep an eye on our skin.
So thank you again, Dr.
Yeah,
Mannering,
thank you.
for talking with us during May month, where we try to heighten the emphasis on the importance of healthy skin.
Great.
Thank you
Thank
so
you very
much.
much. Appreciate it. Thanks.